Hello everyone, Nicolette here with Gab-Nic Excelsior Nursing Tutoring Center, and we are going to be looking at another case study. This is to help those of you who are nurse practitioners or medical students, medical doctors, just to help you in your practice, to give you some examples or practice as to what to do if you have a patient who comes to your office with these problems. Okay, so this patient is a 26-year-old male who has a history of asthma. He's never been intubated, never been in the ICU, but here he comes today with shortness of breath for 1 day. He says he feels as if he had an asthmatic exacerbation. He reports no productive cough, no chest tightness. He denies having any fevers or chills, no vomiting, diarrhea, nausea. He ran out of the inhaler 2 days ago and he never got it refilled, and so today, when he felt these symptoms, he had no inhaler, and he uses the inhaler every day. So he denies any sick contacts, and he doesn't really know what his triggers are, and he denies any substance abuse. So his past medical history is he has asthma. He does smoke, so he has a dependence on nicotine. He suffers from depression, and he has mild intermittent asthma without complications, which he uses albuterol for. For surgical history, he has a surgery for burned skin when he was like 12 years old. So he smokes daily, 1 pack a day. He doesn't usually use alcohol. Well, not usually. He doesn't drink. He has smoking marijuana. Okay, so the system review, we're just going to talk about the ones that are abnormal. Imagine then their system is normal or negative for everything else. So at the moment, we're looking at the respiratory. Just to make this video a bit short, so respiratory, he is positive for cough, he is positive for chest tightness, he is positive for shortness of breath, and he has wheezes. Now, that was a review system, so that's what he was saying, right? Now, what do we see on the physical examination? We're going to go straight to what is abnormal, which is the pulmonary chest. So we have it's normal effort, right? Inspiration and expiration, there's wheezing heard bilaterally in both lung fields, but everything else is normal. His head, his eyes, his abdomen, muscles, skin, psychiatry, right? We're good there. So for medication, previous medication that he was using or is using is albuterol, which is the same as Preventil, and he was getting 2 puffs every 4 to 6 hours. He was also on Zoloft, and that was 100 milligrams for that was daily, 1 tablet. Okay, so he has no allergies, vitals were normal. The assessment, as you were told before, is he has asthma, he has shortness of breath for a day, and he has an exacerbation today. So what are we going to do for plan of care? We're going to give him albuterol, puffs times 8, and 60 milligrams of prednisone, and we're going to do an EKG and chest X-ray, and we will reassess him. Okay, so that is the plan of action for a person who presents in the emergency room or your office who has asthma. You're going to give him the treatment that he needs currently, which is the puffs, right? And then you're going to give him prednisone because that is an anti-inflammatory, and then you're going to do EKG to make sure his heart is not affected, or his heart is healthy, and you're going to do a chest X-ray. Okay, that is for this case study. Thank you for watching. See you next time. Bye.